We were told
Thanks,
that
Laura.
this was all sorted out because there are huge shortages in the farming and agricultural industry, which simply are pretty time sensitive because otherwise, crops just die and rot on the vine. What is happening at the moment and what is stopping these workers getting into Australia?
So a number of things are happening at the moment, Laura. So we restarted these programs in September of last year. There was a pause during the early part of the pandemic. We restarted in September, and since then we've seen now over 11,000 workers coming from the Pacific and working right across Australia, particularly in our agricultural sector and filling those shortages. We're going to see another 1,600 or so in the next month, and we plan to have it doubled from about a month ago when the PM made an announcement to double with an additional 12,500 workers coming in by about March from the Pacific. So there's been a lot of work being done with the states and territories. Now, states and territories have taken different approaches. Queensland for a while did some on-farm quarantine. South Australia had a dedicated facility. Tasmania have had hotel quarantine for both Tassie and Victoria. So there's been a range of approaches and there has been a degree of success. But what we're going to move towards, I think, and where we need to take the conversation as we have our national plan for reopening, as we have 80% double dose vaccinations, and as we look at the COVID situation in the Pacific and the vaccination situation in the Pacific, I think we'll start to see more and more flexibility, and certainly those will be some of the discussions I'll be having with state and territories about how we can bring more workers in.
So are these skilled workers that the agriculture industry needs coming from the Pacific, are they vaccinated?
So at the moment, because there's been quarantine, we don't have requirements to come into Australia to be vaccinated because workers come in just as other people do. They come in and they quarantine to make sure that the community is protected. But there's a couple of points to make. If we look at places like Tonga, for instance, Tonga has had 0 cases of COVID. So it is the definition of low risk, and there are a number of Pacific nations that are very low risk. We're also seeing high rates of vaccination. And when we look at the work-ready pool, so in the Pacific, we've identified at this stage at least about 27,000 who are work ready to come in. Of those, I understand at least about 7,000 are fully vaccinated. And so what we're going to see, and a number of countries are going to be putting in requirements for vaccinations. We've been delivering vaccines to the Pacific. So, for instance, in Fiji, where they have had higher numbers of COVID, higher case numbers, they are also around 96% first dose done and more than 50% double dose. So we're seeing either very low rates of COVID in some of those countries or 0, or we're seeing high rates of vaccination. So that, I think, will put us in good stead. But I think, Laura, when we do look to the next couple of months as we see a national reopening, obviously, places like New South Wales and I think the rest of the country, we're going to start to live with COVID. So our arrangements for workers coming from overseas, as it will be for Australians coming home, will have to change over time. And of course, we'll look for flexible options to keep the community safe, but to recognise the relative risk factors, particularly when you're bringing in people from places that actually don't have any COVID.
Right, because these farmers are desperate to get these workers, and they're not unskilled workers. It's things like harvesting, which has a degree of skill, which can't just be filled by unskilled work here in Australia. It does make sense, doesn't it, that once we reach a high level of vaccination here, these workers can go straight to these country towns and quarantine at home if need be. Even perhaps, are you talking about a reduced length of time for quarantining if they're vaccinated?
I think all of those things are on the table. New Zealand have announced that for certain countries in the Pacific, certain lower risk countries in the Pacific, I think from October they're intending on having a sort of a home isolation for a shorter period of time or an on-farm as appropriate. So I think those kind of things really need to be looked at. Other things in the short term, I've been having discussions with the states and we've been raising with their relevant health authorities that the classification of certain countries I think needs to change, or the consideration of certain countries. And I mentioned places like Tonga that do have 0 COVID. that's clearly a low risk. The far bigger risk for those Tongan workers would be potentially when they went back, and obviously that's a risk that those countries need to manage, and it's important that they do, and vaccination will be very, very important to that. But look, the streamlining we've announced today is also going to provide better pathways for these workers. It's going to make it more flexible for employers. So we're changing things like the market testing will last from now at 6 months, it'll be 12 months. There'll be increased caps. We'll see changes to the age limits. At the moment, there's a 45-year age cutoff. It'll be available in bigger parts of the country. So there's some really important reforms here, which I think will see us be able to build on what has been a really successful program. Yes, quarantine has been one of the constraints. We've been working through that and still getting over 11,000 in. But as we see these changes to make it easier for employers, and as we work to a new reality with states and territories, I think we'll see many, many more coming in. And that's of great benefit to Australia, but it's also of great benefit to those countries in the Pacific who have really been hit very hard economically, even if they haven't been affected in a health sense.
Zed Seselja, thanks so much for your time this morning.
Thanks very much, Laura.